is very dear to my heart because I'm a gynecologist. I'm an obstetrician. I deliver babies in day in and day out, and it's a very precious and special phase of a woman's life. And you all would-be moms are obviously very concerned to keep your child as healthy as possible, and so you are very concerned about, because the child is growing inside you, so you are really concerned about what you should eat or what you should not eat. So and there are a lot of myths that, from the elder generation, the previous generations, they'll tell us that don't eat this, this is bad for you, this is good for you. So lots of these issues are there. So I'll just try to make things simpler for you, so that you know what to eat, what not to eat, and how to go about nutrition and diet as far as pregnancy is concerned. Now, for a normal adult, around 1800 kilocalories of energy is required in 24 hours, average activity kind of a human being. But during pregnancy, obviously, the need will go up because there is a baby growing inside you. The baby will need some calories, and on top of that, with the baby growing inside the system in the woman's body, there are lots of changes. The blood volume increases, so many things, there is change. There's a placenta that is also growing. So for all of this, all of that together, we need more energy, more calories than is required in the non-pregnant state. So if a normal adult needs around 1800 kilocalories per day, then in pregnancy it becomes 2100 or even more, even probably up to 2400 kilocalories. And in the first trimester, in pregnancy is divided in three trimesters: the first, second, and the third. The first trimester is the first 3 months till 12 weeks. Second trimester is till 28 weeks, that is 13 to 28 weeks. And the third trimester is after 28 weeks till the delivery of the baby. So during these three trimesters, those of you who have already faced a pregnancy, you know that nausea, vomiting in most of the cases is very, very heavy during the first 3 months, which we call the first trimester. And because of this vomiting, it is difficult actually to, eat too much. So for the same reason, because it is difficult to eat, thereby we cannot unnecessarily ask you to take more calories, because whatever the normal calories, that also becomes difficult for you to take because of excessive nausea and vomiting. So during the first 3 months, the calorie requirement remains the same. After that, it goes up minimum of 2100 kilocalories, and may go up to 2400 kilocalories also. Those who are very thin will need more kilocalories. Those who are slightly overweight might be needing less amount of extra calories. So the basic diet, what you should do, the same diet that you're taking in the non-pregnant state, you should take it a little bit more of the quantity. Adequate vitamins and minerals for the proper growth of the baby. Protein also adequate amounts for proper growth of the. We need a good diet, but because of the nausea, vomiting the first few months, you are unable to take too much at a time. So what we say, go for small frequent meals instead of major meals. Go for 6 meals probably throughout the day in smaller quantities, so that you more or less can make up for the entire need. So that is about the first trimester. Now a few questions are which are frequently asked are, what to eat when you're pregnant. So as I mentioned, whatever you eat in the pregnant state, the same things you will be eating during pregnancy. But the issue is that them in small frequent meals, so it becomes more convenient for you and you don't throw up. First in the morning, if you can take a little bit of dry biscuit or dry toast, then that will improve, to eat that, and the throwing up will be less. So that is one of the things that about during the first few. And otherwise, the other everything are carbohydrates, proteins, unsaturated fat, minerals, vitamin, and lots of water and fluids are all required during pregnancy. So it's not that we cannot eat fish, or for non-vegetarians, fish eat, or fish, meat, eggs, that you cannot eat them in the during pregnancy. That's wrong. You can take them, but they have to be properly cooked. That is very important. Those of that is for throughout pregnancy. When we are having non-vegetarian items, we should ensure that they are properly cooked, because uncooked can get a lot of infections which can be harmful to the baby. It can also cause a lot of diseases in the baby, also malformations in very severe cases. So we have to be really careful about choosing our non-vegetarian food. If it is well cooked, properly cooked, then in most of the non-vegetarian foods there is no problem. Vegetarian food as such, there is no problem with any kinds of food. There are lots of myths about various foods which I will just talk about. So some food myths are that full cream milk is more nutritious than low fat milk. Full cream milk has lots of cream, which can be detrimental to your your own existence. So full cream milk does not really do a lot of good to anyone. So also during pregnancy, the low fat milk is as good as wheat cream milk will be. So if we are taking low fat milk from before, I think it is wise to continue with same. Then cooling, another myth is that cooling foods like papaya, pineapple, citrus fruit, all of these, green banana should be avoided as they can cause miscarriage. Unfortunately or fortunately, fruits do not, papaya, pineapple, no, all of that, they act too much of a problem. Tell you something, what I tell my patients is that because there's so much of myth about it, all the seniors, most of the people you come across will tell you don't take papaya, don't take pineapple. So the thing is that unfortunately, if any of you undergoes some pregnancy complication like a miscarriage or something, and if you have taken an apple or papaya, what happens then? You tend to blame that particular thing. Probably the miscarriage, if it has happened, is because of some other reason, but because you have taken papaya and your seniors have told you not to take it, so you tend to blame that particular thing first. So what is that? At least during the first 3-4 months, if you have other fruits there, because other fruits are also available in abundance, so if you can take other fruits, then it is better that you avoid them, just so that you do not get into that kind of a situation where you start blaming yourself only for that reason. But for all practical purposes, none of these foods have any of the problems that can actually be bad in pregnancy. So another myth, can I replace vegetables with fruits during pregnancy? This someone has asked. So both fruits and vegetables during pregnancy, or as diabetes is concerned, some women have diabetes beforehand, some women develop gestational diabetes during pregnancy, and in that situation, what happens is that we have to cut short the calories, the sugar, and all that. So in that case, your dietitian, you have to meet a dietitian, and the dietitian will be able to tell you which fruits are safer for you. Like and some of the fruits might be not very good when you have diabetes, but certain other fruits like apples and melons, these kind of things, the citrus fruits like lemon and all, these can be, grapes can be more suitable, even pomegranate, but probably some extent mango. These are the ones that might be avoided or taken in a lesser extent as far as diabetes is concerned. But if you are non-diabetic, then there is no restriction as far as the fruits are concerned. Another myth is that I must take supplements to meet my pregnancy requirements. So the thing is that yes, we do give minerals and vitamin supplements during pregnancy to ensure that you take adequate amounts. But trust me, if diet has nutritious diet, then with all kinds of dals, lentils, legumes, then fruits, vegetables, and all, if it is a bad, then an added requirement for any of these in the medication form or as supplementation form is really not required. If you can get it from your diet good enough, just to ensure that you get it. Many of us, most of the gynecologists, we actually tend to prescribe supplements containing minerals and vitamins just to ensure taking them, but normal nutritious diet, it should be coming anyways. Another question is that with me is that eating seafood during pregnancy can cause my baby to suffer from skin rashes and other skin problems. Actually speaking, seafood, if it is cooked well, should not cause a problem. There are certain human beings as such who are allergic to seafood, so they should not be taking it otherwise. So also in pregnancy they will not be taking it, but as such that seafood is going to cause harm or rashes in the baby when the mother is not allergic to it is not something that we have ever shown any concern, or really not that true. So these are the questions I got. If anyone has any other question, then you can ask. So I would like to summarize that in pregnancy we should have adequate nutrition diet, and the requirement is around 3 to 400 kilocalories more than the normal, and more so in the third trimester. In the first, adequate whatever amount we can take in small doses is good enough. As I said, probably 6 meals is good enough, with small quantities. Okay. Prachi is asking, hello doctor, how much I need to eat if I'm pregnant? Should eat more? Said we need 3 to 400 kilocalories more in the second and third trimester to the whatever you were eating before. Try to increase the with more of vitamins, minerals, and proteins. These will be essential for the growth of the baby. Any other question? Okay, so as I said, we need a little bit more than the usual, but in the first trimester, because of excessive nausea, vomiting, we wake. That is why second and third trimester we will try to make it up by taking 3 to 400 extra kilocalories per day. Whatever amount we eat pre-pregnancy, we have to add a little bit more of everything. All can be taken, but yes, okay, saffron. A lot of people say that if we take saffron, the baby will be fair. That is not. But there is no harm in taking saffron in small amount. Is not required. Coffee, tea in too many heavy amounts is also not to be taken, but small amounts can be taken. Rashi is asking, any other myth that I need to know more? I am 10 weeks pregnant. Yes, it's your first, and to 10 weeks, till 12, 13 weeks, you will not be able to take too much of food. As I mentioned, frequent meals is the best thing, and try to take whatever you can. Milk is some should take. Milk, dairy product, very beneficial to protein. For a vegetarian, it put various kinds of dals that we take, mixed dal or different dals. Suppose you take rajma today, you take tomorrow, you take a mixed dal the day after, two dal someday. So a combination of the different dals once every day, that should be good enough. If you eggs, then eggs is also good. A proper cooked egg, not the raw or half boiled, should avoid, because we do not for you or your baby. That is properly cooked. Fish, meat, if someone is a vegetarian, fish, meat, everything, anything that is properly cooked, good enough. But not red meat that can hamper the digestion. Also, something that will be easily digestible is something that is more beneficial to you. Padma is asking, will make the delivery easy? No, all of these are really myths. It really is not like that. What will make your delivery easy is that if you can adequate exercises in the phase. Last few weeks, like they say in many families, they say ghar pe poch. So because that in that squatting kind of a posture, it will make the pelvis more relaxed, and it will help. But eating ghee is really beneficial. You can eat a little bit if you like the taste and all, not much, because again that will become actually speaking, that ghee is going to help in a normal delivery. Myth. Do I need to avoid non-veg in first trimester? Archana, no. As I mentioned, if it is well cooked, then there is no problem if you have it. But like half-boiled eggs or poach and those kind of things in first trimester, where it is not properly cooked, you avoid. People who are very fond of foods like sushi, which is semi-cooked, almost uncooked fish and all, better not to take. If you directly eat ham, salami, those, I would say better you eat those kind of meat forms which are totally cooked. You know that it is well cooked, because this process kind of meat can it can give rise to other diseases, and especially during pregnancy we cannot take a chance. So a takeaway message I would like to give to all my viewers, the pregnant woman, the pregnant and would be pregnant woman is that you should eat nutritious and healthy diet during pregnancy, and do not worry about eat what is hardly any uh, you know uh, anything that you're not supposed to eat unless you're thinking about uncooked even vegetarian food. When you're eating it, it should be washed properly, because infections can come from the improperly washed food. So the non-veg food has to be cooked properly. The vegetarian food be not only cooked, even if you're going for salads and all, they should be very, very nicely washed. And there is nothing that this fruit is going to cause any harm, that is going to cause any harm. No, everything more or less safe during pregnancy as far as food is concerned. But yes, too much saffron, too much of certain spices, then oil, ghee, all these things in excessive amount is avoidable. In moderate amounts, it is absolutely okay. And in the second and third trimester of pregnancy, you need 3 to 400 kilocalories extra for the demands by the growing baby. So just ensure that you're taking amount of food should be there.